Okay, so now we're going to go to stomach line. You have to be very careful if you're older, you had a whiplash, you've had injuries, you've had surgeries, and you're tight in the front. If you had abdominal surgery, you may be tight and you cannot lie in the stomach. And so if your doctor's told you or a physical therapist, don't lie in your stomach, you have to listen to them. But if you're younger and more supple, or even if you're older and more supple, you can lie in the stomach. Some people can do it. I'm halfway there. I've had many injuries and I'm a little trouble in the stomach, but I try it now and then. I'm able to do it. So you're able to lie in your stomach. So go ahead and lie in your stomach. And again, if we can find a way to create the primal C curve of the spine, this is going to relieve some of the stress of stomach line. So if you can bring this knee up, that's it. So this is almost like a body pillow. If you had a body pillow, it could go here between the knees and lift you like this. But this is actually better than what you had with the legs straight because you have some curve here. The back isn't so hyperextended. Now the neck, if you're comfortable on the neck, many people can't do this because the neck is compromised. If you have a little pain in the neck, you can sometimes use a cushion under the back of the head to just like that's it, to get a little rotation so it's not quite so stressful. That makes it a little more comfortable.
Yeah.
So this is actually one kind of a curve of the spine. You're kind of side bending the spine. And if you look at me from the back, she has her leg like this and like that. It's a curve of the spine sidewise, which is like scoliosis is multiple curves. But if you can create a curve like this and then move it, then you can get control of scoliosis. So if you're able to turn the head the other way, keeping this. So now she has one curve here going like this, other curve going like this. She has a scoliotic curve as she's lying here, but she created it deliberately. Now some people think, I don't want scoliosis, I don't want a twisted spine. But if you are able to create it and uncreate it, you don't have scoliosis. You have a healthy, supple, vibrant nervous system that can take control of the whole situation. So if she can comfortably do this and then reverse, go ahead and turn your head and then bring your leg down and your arm and turn to the other side. And do the same thing. We'll first bring the head towards me. This is the simple C curve where she's curving like this, the C, more or less. You could actually curve more like that, if you like. And then if you're able to turn the head the other way, this takes suppleness. Kids can do this. Babies can do this. If you can do this comfortably, you don't have scoliosis. You have a spine that can go from here to here to here to here like that. That's a healthy nervous system, a spine that can do that. An unhealthy nervous system is a spine that can only stay straight and nothing else. That's all it ever does in life. That's not good posture. Most people think it is. It's not. So that's basically what I have to say about sleeping positions. So maybe you can come up. That looks a little uncomfortable how you are. But I wouldn't spend very long like that. But it's something to explore if you're supple, if you are younger and you're comfortable. The material presented here is for information only. It summarizes the main tools that I have personally used for about 25 years as a Feldenkrais teacher. I've worked with many clients with serious medical issues and other people, and I've found these ideas are safe and simple, they're effective, but common sense dictates that you need your doctor's permission. If you have any questions, if there's any pain, you shouldn't do a movement, you should always be gentle, go slowly. If you have any doubt about the safety of a movement, respect that and don't do it. You can see a professional teacher of movement, an Alexander or Feldenkrais teacher. These people are very good. They've studied posture for a lifetime. You can trust them, and they can look at you, and in a glance, they can tell you what is going on in your body and what you need to do particularly to help yourself. And this can save you many years of futile effort and struggling, doing everything or trying to accomplish something you don't really need to accomplish in the way of posture. When you have a professional, experienced person looking at you and you follow their advice, it can save you lots of effort and time.